Welcome to a 5-minute tutorial on pericardial sac, cardiac tamponade, and pericardiocentesis. Let's first talk about pericardial sac. The pericardium or pericardial sac is a fibrous serous sac covering the heart and initial heart vessels. Imagine the heart as an orange. The pericardium would be the peel around it. It includes a serous layer and a fibrous layer. Here we're using different colors to demonstrate different layers. The serous layer includes an outer parietal layer and an inner visceral layer. The space in between is called the pericardial cavity and is filled with a thin lubricating layer of pericardial fluid to minimize friction as the heart contracts. The fibrous layer is a layer of connective tissue that wraps all around the heart, just like the peel of an orange. The fibrous layer merges with tunica adventitia of great vessels. It attaches to posterior sternum via sternopericardial ligaments and fuses inferiorly with central tendon of diaphragm, fixing the heart in the mediastinum and acts as a physical barrier to protect the heart from infection. It is tough and inelastic, so it can protect the heart against sudden force or pressure change. As I mentioned, the parietal layer is the outer layer of serous pericardium that fuses with fibrous pericardium, while the visceral layer, also called epicardium, is the inner layer that covers the myocardium, and the space in between the two layers is called the pericardial cavity, filled with pericardial fluid. Going back to orange metaphor, the fibrous membrane would be the outer peel of an orange, while the serous membrane would be the inner white layer of the peel. Just to help you visualize other heart structures, here I'm adding in the chambers of the heart. This might not be the most anatomically accurate drawing, but I'm hoping it can give you a better idea of the various structures inside the heart. And again, here's a simple demonstration to show you the different layers of the pericardium, which are the main focuses of this tutorial. Next, I want to briefly talk about the pericardial sinuses, which are spaces formed by the serous pericardium folding on itself. The transverse pericardial sinus is located posterior to the ascending aorta and pulmonary trunk, and anterior to superior vena cava. This tunnel-shaped sinus is clinically significant as it can be used to identify and ligate the arteries of the heart during surgery. The oblique sinus is a blind ending passage posterior to the heart and the left atrium, and it lies in between the left and right pulmonary veins. The somatic innervation of the pericardium is the phrenic nerve, which in the case of pericarditis, it can be demonstrated as shoulder pain. And pericardiophrenic artery and veins are the main blood supply and drainage of the pericardium. Moving on to cardiac tamponade, it occurs due to rapid or extensive accumulation of fluid in the pericardial cavity, aka pericardial effusion. In cases when there's not enough time or space to stretch to accommodate the increased volume in the pericardial cavity, the fluid can put pressure on and squeeze the heart, reducing the ventricular filling and cardiac output. The right side of the heart is usually more impaired because of its thinner myocardium, making it easier to collapse. These fluid can be blood, which happens more rapidly, or serous fluid, which happens more gradually. Hemopericardium occurs when blood accumulates, and causes include weakened ventricular wall post-myocardial infarction, penetrating trauma, aortic dissection, and surgery damaging the heart and causing blood to leak into the pericardial cavity. Infections, neoplasm, and autoimmune conditions can also cause inflammation, which increases capillary permeability, and fluid can leak through the capillaries and accumulate in pericardial cavity. Decreased cardiac output can lead to hypotension, increased jugular venous distension, and muffled heart sound, which are the Beck's triad, aka signs of cardiac tamponade. Decreased cardiac output decreases mean arterial pressure, leading to hypotension. Jugular venous distension occurs due to blood backing up into the superior vena cava, and the increased fluid surrounding the heart can affect the transmission of heart sound. Cardiac tamponade is considered a medical emergency and needs to be treated immediately. Echocardiogram is the gold standard diagnostic tool, as you can observe the stretch and filling of the heart, and it can also be used to guide pericardiocentesis. Initial treatment includes intravenous fluid, which enhances blood volume, and pressors, which increases mean arterial pressure. However, pericardiocentesis is the ultimate treatment, and immediate result can be seen as fluid is drained from the pericardium until the hemodynamic improves. It is done by inserting a needle into the pericardial cavity to drain out as much fluid as needed via apical, peristernal, or subxiphoid punctures. In some cases, fluid can reaccumulate, and the drain needs to be placed via pericardial window to continuously clear out the fluid. And remember, the ultimate goal is to figure out what's causing the cardiac tamponade and fix the issue as soon as possible. And that's it on pericardial sac and pericardiocentesis. Thank you so much for watching.